and hand it over to Harley.
Okay, hi everyone. Thank you for joining us. This is our second session in the Indigenous Parenting webinar series. And before we get started, our Xpey Wellness team wants to begin by acknowledging and honoring the diverse Coast Salish nations that we work with and whose territory we reside in. And so our team is made up of a diverse group of people with roots and ancestries in different nations and cultures. And so we acknowledge that when we show up in this work and within these communities, we're doing so as guests. And so very quickly, Xpey Wellness, our team is made up of Bianca Elliott, Marco Cafiero, and myself. My name's Harley MacArthur. And yeah, so this is the Indigenous Parenting series. If you do have any questions throughout it, feel free to unmute yourself and ask a question when it comes up. If you don't want to do that, you can type it in the chat and I will ask Ashley or Marguerite when it comes up. And then also what we did in the last one that worked really well is at the end, we stopped recording and then just, left some time for people to unmute themselves and just kind of had a conversation, and that worked out really well too. So yeah, it's a pretty casual environment, and so if you want to show your camera and ask a question, we would really like that. And another thing too, so Bianca has some door prizes for today, and so how we'll choose the winners for that is throughout the presentation. If you have questions, we'll at the end we'll ask Marguerite and Ashley to pick their favorite questions, and then the people that ask will get the door prize. So I'll pass it over to Bianca quickly to show you what the door prizes are.
Yeah, so we have a bunch of pacifier clips. They have teething beads on them, so they're good for teething babies. They come in a bunch of different colors, and I have several of them, so we can choose a couple or a few different, I guess, recipients of the door prizes, and we'll do that at the end.
Awesome. And
I remember my doctor said I can't eat hot dogs.
Yeah, so before I pass it over quickly, so today's webinar is about breastfeeding, and so it is also National Breastfeeding Week, and so we are joined by Marguerit James and Ashley Simpson, and I will let them introduce themselves. But quickly too, we do have a survey that I'll put in the chat below, and so at the end, if you could just take like a couple minutes to fill it out, it would really mean a lot to us. And so yes, I will pass it over to Marguerite.
Good afternoon, everyone, or is it morning? I want to, my name is Marguerit James. My Indian name is Xpey. I come from Penelakut tribe, and Penelakut is called Penelakut. Tanitana Penelakut. Nilkutnisna Xpey. Glad to meet all of you.
Thank you, Marguerite. And could I invite you to open us up with some words and an opening prayer just to start us off today?
Okay. Thank you, Creator. Thank you for blessing me to be with this beautiful people today. Creator, you bless us. You bless us with children. Every day we have children that come to us, the beautiful babies, that the gift that you give us, Creator, the gift that's out there for us, and to cherish these gifts that the Creator is putting upon us, that we had a wish for that baby, and now you, Creator, have given us that wish and given us the gift of life, and for us as mothers to know that we're going to love and care for them in the best way we can. And Creator, I thank you for letting me be with all the different nations of people, so that we can work together. And if we work together, we can make a better world for all the mothers and the babies. And also the last thing I want to say, a better world for our Qualmuchmastimo, our native people. I want to say bless you, all of you that are in my circle today. I want to bless you as you leave our circle today, and have a blessing in your heart, in your spirit. I want to uplift your spirit to know that you're okay and that you're a good mom to be. And for the workers that are sitting with me, I bless you for having us get together and we can help our Qualmuchmastimo, our native people. Hachpa.
Beautiful. Thank you, Marguerite. Thank you for starting us off in such a beautiful way today. So hello, everyone. My name is Ashley Simpson. My family is Wet'suwet'en. My mom is Wet'suwet'en from the Hegwilget Nation, and I'm also English and Scottish on my father's side. And very grateful to be joining you today from the traditional Coast Salish territory of the Snuneymuxw First Nation, where I live with my husband and my 2 kids. And so I have a bit of a background in doing doula work, in childbirth education and breastfeeding counseling, and have had the privilege of supporting families alongside Marguerite for about 8 years now. And so very grateful to have the opportunity to be sharing this information with all of you today alongside Marguerit James. And I also want to say thank you to the Xpey Wellness team for inviting us to be here and to share with all of you today. And so I'm just going to open up, I have a PowerPoint or a slide presentation just to kind of guide our conversation. As I already kind of mentioned, but I want to acknowledge Marguerite and I are both presenting from Coast Salish territory here in Snuneymuxw on Vancouver Island today, and want to acknowledge all of the traditional territories that you're all joining us from today. And so I wanted to start off our conversation today by just honoring some teachings that have been passed along to me from a Salish elder, Jerry Ullman. And he often talks about the importance of giving thanks and acknowledging those who have carried us and nourished us and loved us and just really supported us to be where we are today. And so wanted to share this, this picture of my great-grandma, grandma, my auntie, and my mom as we're you know, having a conversation today about breastfeeding and just the importance of community and family and support in nurturing the future generations. So as Harley already mentioned, this week is an exciting week in the breastfeeding world. It's National Breastfeeding Awareness Week here in Canada, which means lots of exciting resources and events and things coming out on social media platforms and things. So lots of really great information coming out from different organizations and support groups this week. And so I also wanted to start off this conversation by just acknowledging that breastfeeding is a choice that we make as families and as parents. And I really believe that, you know, parents know what's best for them and for their baby. And as we, you know, get into kind of more discussion around what the benefits of breastfeeding are for babies and for families and for communities, just honoring that everybody makes a different decision about what works best for you and your baby. And just know that, you know, whatever amount of time or, you know, amount of breast milk you're able to provide for your baby is truly a gift, and that I really respect the decision that you make for you and your family. So the World Health Organization is an international agency that they put out health recommendations and kind of best practice guidelines around all things health related. And so the World Health Organization also has recommendations around breastfeeding. And so I was going to go through a few of those with you guys. And so the first one that the World Health Organization recommends is to initiate breastfeeding within the first hour after baby is born. And so this has benefits for both mom and for babe. And so breastfeeding in the first hour after birth, if baby is put to your chest and able to latch on and start feeding, it actually helps with the third stage of labor, which is birthing the placenta. And so the sooner that the placenta is birthed after baby is born, it reduces the risk of bleeding and postpartum hemorrhage, which is obviously a health benefit for mom. And then it's also shown that breastfeeding in that first hour after birth really helps to increase the likelihood that baby will breastfeed well, and breastfeeding will be kind of established and successful over the breastfeeding journey for babe. And so the World Health Organization also recommends exclusively breastfeeding for the first 6 months of life. And that, sorry, my dog is whining in the background. But so exclusive breastfeeding looks like only breast milk for baby in those first 6 months of life. And so no other solid foods or liquids, including water, are recommended until baby is at least 6 months of age. And this actually helps with decreasing the risk of baby developing any allergies or food sensitivities. And so it's also recommended that breastfeeding is done on demand, which is basically saying that baby gets to feed when and where they want. Breastfeeding on demand means, night and day, baby is showing signs or cues that they are interested in feeding, and the breastfeeding person is responding to those. And so it's also recommended that no bottles or pacifiers are used in those early days, especially when you're first establishing that breastfeeding relationship. And this is just to kind of better increase the parent's ability to read some of those cues. So baby might be, smacking their lips or sticking their tongue out, or they might be bringing their fist to their mouth and kind of showing these signs that they're interested in feeding. So sometimes if we offer a bottle or a pacifier, when we see some of those signs, we're missing some of those feeding cues. And so we want to be responding to those. And sometimes babies feed for other reasons than nutrition. Baby may not always be hungry. Breastfeeding is an amazing way for, connection and comfort and pain relief. And so there's so many reasons why baby might be interested in feeding. And so it's really encouraged that the breast is always offered, despite if it's, baby's actually hungry or not. And then at 6 months of age or beyond, but 6 months kind of being the earliest stage, baby can start being offered safe and nutritious foods, but while still continuing to breastfeed as you regularly would for up to 2 years and beyond. And so some babies are interested in solid foods at the age of 6 months. Sometimes it looks a little bit closer to a year or beyond. And so it's important to be offering those foods. Kind of a common practice is, when family sits down to the meal, foods are offered to baby. Maybe they're sitting in their high chair. They're a part of that, family dynamic at the kitchen table. And baby is able to kind of explore those foods. And if you've ever witnessed, a 9-month-old or a 1-year-old eating solid foods, about 99% of the time that food doesn't make it into their mouth, but that's okay, because there's a saying that food before one is just for fun. And that's exactly what it is. Babies, exploring those textures and flavors and practicing their fine motor movements. And it's really just kind of a time for baby to explore. And they're still getting the majority of their nutritional needs met by either breastfeeding or formula. It can get a little bit messy, but it's an amazing learning experience. And so, oh, sorry, of course. Were you going to share, Marguerite?
I was. I'd like to give a little bit of history and information of our time as mothers, because I'm an elder and in my time, we were taught to, they don't have all the different things that mothers can, told me that in order to make your, to prepare for your baby, when you're going to have the baby, he told me, you get a kind of a sharp towel and you rub it on your breast about 10-15 minutes a day, and what it does is it toughens up your nipple, because the reason is to prepare yourself for when the baby is going to start suckling on your breast. And also, and one thing that you need to know is that some babies are really strong when they suckling on your breast. Some are pretty strong, and I had one baby that was really strong, and my nipples got cracked, and it was really painful to feed. So in order for us as young mothers, then we had to rub that and prepare for our baby. And one thing I like to say too is that it was natural for our mothers to breastfeed. There was no other alternative but to breastfeed. And I like to tell a story about a grandmother that I met, and she said to me, I was trying to feed my baby, and my baby would not accept my breast milk, she said. But you know that our milk from the moms are nutritious. There's different nutritional values that come from the mom that the babies get, that you don't need to have medical stuff from the drugstore, and your breast already has those nutritional values that's in the breast milk that helps your baby, and it's kind of helps them health-wise. But I'll tell you about this. I'll go back to my story of this elder. She said that her baby would not accept the baby milk that was coming from her. So our people in our time, we had to find other ways to feed the baby. So what she done was she got the link cod, and what she done is she made broth. She cut the head off, put it in the pot, and she made soup. And what she done was she used the broth to feed the baby, and the baby took the broth, but wouldn't take the breast milk, but took the broth from the lingcod, the fish. So our people had to find different ways to give them nutrition, but we found a way. So I'd like to put that in there. You'll notice baby is facing mom's breast with her head and body in line, not having to twist and attach. Sometimes mom has to fix a way so that she can get have it comfortable for her and the baby, because you can't have the baby nose, stuck in the breast, so that the baby can't breathe. So that's just one point that I want to put across, because Ashley, you may have other information. I might be getting ahead, but I wanted to tell you that was the old-fashioned way to rub your breasts before your baby comes, and make your nipples strong so that you can endure the suckling from your baby. That's an old-fashioned teaching. Thank you.
Thank you, Marguerite. And that was the perfect segue into talking about, you were sharing how our breast milk has everything that our baby needs. And it was the first traditional food when there was no such thing as formula or other ways of supplementing nutrition for our little ones. Yeah, so really grateful for you sharing those words. Thank you. And so exactly what Marguerite just said, there's so many benefits of breastfeeding baby, and our breast milk is often referred to as being the perfect food because it does contain everything that our baby needs, including antibodies and other molecules that help to keep our babies healthy, helps. It's kind of like our built-in pharmacy. Our babies get our breast milk, and our bodies respond by producing antibodies to help them fight any infections or colds or illnesses. So for instance, things like diarrhea or respiratory illness, helping with childhood obesity and diabetes. Our breast milk really helps prepare baby's body and support their bodies to be healthy throughout infancy and throughout life, actually. One of the other huge benefits of breastfeeding is that it promotes healthy attachment. And so attachment is something that we talk about a lot in kind of healthy social and emotional development for our little ones. And so attachment is basically the relationship that forms between the caregiver and the baby. And so in this circumstance, we're talking about mom and baby. And so all of the elements that make attachment work really well are present in breastfeeding. So things like, smelling mom, hearing mom's voice, hearing mom's heartbeat, getting that skin to skin time, all of those pieces, eye contact, all of these pieces that really promote healthy attachment. And so breastfeeding helps to really foster and nurture that relationship. It also, breastfeeding helps with release of oxytocin. And so oxytocin is often called the love hormone. And so that's released in mom and in baby when breastfeeding occurs. And so that just helps to strengthen that attachment bond. Breastfeeding also promotes healthy tooth and jaw development, and can even help with things like speech and language development. Breastfeeding promotes healthy brain development, and it's sort of what we already talked a little bit about, the social and emotional development. And it also decreases the risk of sudden infant death syndrome, or SIDS.
I'd like to add on to that, the connection between the mom and the baby. That first connection that you have with the baby is the most important time in the mother and the baby's time in their life, for that connection to happen. And it's so beautiful, and it's just natural for the babies. They taught me, just put your nipple on the baby's cheek and the baby will find it. And they did. And that connection I had with my baby, that was the most important time in my life as a young mom, to know that I had an impact on that baby and we were connected in a good way, and we could use that time for feeding to have that connection happening between mom and you, connection happen. And that's it's so that you have to enjoy that. And sometimes you lay down and you fix it up so that you can lay with your baby and enjoy that time. You know, that connection period between you.
Thank you, Marguerite. And that just reminds me of, I mentioned it kind of briefly, but it promotes skin to skin. And so as Marguerite's talking about connection and having that relationship and that special bond with baby, breastfeeding is really an opportunity to increase skin to skin time. So every time baby is brought to the breast, skin to skin is happening. And so that's a really amazing opportunity to help baby with regulating their body temperature and their heart rate and their breathing and their blood pressure. And so all of these really amazing health benefits come for both mom and baby actually when there's skin to skin time. And so it's also a huge factor in nurturing that attachment relationship. So thank you for that reminder, Marguerite. And so there's also a lot of benefits for mom and for family that come from breastfeeding. One of the benefits of breastfeeding in that first hour after birth, but also in those first days, is that breastfeeding helps to control postpartum bleeding. And so oxytocin is released when we breastfeed. And so after we've had baby and we're talking about birthing the placenta, oxytocin is released and helps our uterus to contract back down and expel the placenta. And then also in those first postpartum days and weeks, you might notice that when you're nursing your baby, you're feeling kind of crampy or kind of contraction-like sensations. And that's your uterus contracting down to its pre-pregnancy size, which is a really healthy process that we want to happen and helps to control postpartum bleeding and prevents any hemorrhaging. And like I already mentioned, breastfeeding releases hormones such as oxytocin in mom and in baby. Also skin to skin with any caregiver. So if dad or grandma or somebody has baby, skin to skin, they're getting that amazing oxytocin release too, and helps strengthen those attachment bonds with other caregivers. But oxytocin is really important for postpartum because it helps reduce stress, it helps with pain relief and recovery time. So it helps with mom's healing after birth. Yeah, just really helps for mom to kind of stave off any symptoms of depression or anxiety. So it can help with those elements as well. Breastfeeding decreases the risk of breast cancer, uterine cancer, ovarian cancer, and things like osteoporosis and type 2 diabetes for mom. And so the way that that works is the longer that you breastfeed, increased benefits, health benefits you get from it. And so, for instance, your risk of breast cancer decreases the longer that you breastfeed for. Breastfeeding helps return to a healthy body weight postpartum. So mom's body is working so hard to be producing that nutritious, healthy milk for baby, and it's burning a lot of calories while doing that, that hard work. And so really helps in returning back to a healthy body weight after baby is born. And of course, breastfeeding is convenient, available anytime. It's always the right temperature. Most of the time, there isn't really any extra equipment or supplies that are needed. So, so easy if you're, visiting family or, on the bus or the ferry or something, and, baby needs to feed and there isn't really any extra steps needed. You can just feed your baby then and there. And they say that breastfeeding is supposed to help caregivers get more sleep, because you're not getting up in the middle of the night to prepare bottles and things. So there's a few less steps involved with breastfeeding your baby for those night feeds. And so maybe you're getting a little more sleep. And of course, breastfeeding is free, which is an enormous benefit for families.
I'd like to add on to that. We need to look after mom. Mom has to eat the proper food. Her diet has to be okay, and not eat acidy foods or drink liquids that have acid in it, because it tends to irritate the baby. So if you may have fed your baby and you think the baby's full, but sometimes mom eats the wrong thing, and it's causing stress in the baby, so they have tummy ache and they're crying a lot. And it's not that they're not hungry, it's just that mom has ate the wrong food. And I was told a lot of foods that I couldn't eat, and I thought at the time, why are they being mean to me, and why is it telling me not to eat this and that? But it was for my own good, so that I could look after my baby in a good way and not hurt her by having tummy ache and crying constantly because I ate the wrong thing. So moms, we have to look after ourselves all the way through. And also, we have to be calm. And I know sometimes you go through stressful times, and we need to be calm down, and so that the baby doesn't feel that, because that connection between you and your baby has to be a really nice, calming time, so that you two can enjoy that time. So that's one thing I did wrong, was to eat the wrong food, drank the wrong thing. And when the elders say don't drink this and don't eat that, they know what they're talking about, because it's for our own good, so we can take care of that baby when we're breastfeeding.
Thank you, Marguerite. That's another perfect segue into what I was just, going to talk about around ways to support breastfeeding in the trimester. And so sometimes the first 12 weeks after baby is born are referred to as the fourth trimester. There's 3 trimesters in pregnancy. And so those early days, weeks, and months after baby is born are another really significant time of change and development for baby and for mom. And so it's, it can be a really beautiful and exciting time. You're getting to know your baby, you're learning all about them, you're developing this relationship with your baby, but it can also be challenging and a bit stressful as you adapt to new routines, new sleep patterns, and if you're learning to breastfeed, then that can be an added stressor too, because sometimes it takes a little bit of time for mom and baby to work out kind of all of the pieces that need to come together for breastfeeding to work well. And so regardless of if it's, your first time breastfeeding or, your 6th time breastfeeding, every baby is different, and it's a different relationship with each baby. And so sometimes it takes a bit of time to work that out. And so there's some ways that the people around you, your community, your family, your care providers can work to support your breastfeeding journey to, really hold you up and support you while you're establishing breastfeeding in those early days. And so one of the ways that, parents or your partner or a doula or outreach workers, families, friends, grandmas, aunties anybody can really honor that that time, that postpartum time, is you know, offering to either take baby for a little bit, you know, letting mom go have a shower or a bath, or you know, have a meal by herself, or if there's older children in the house, offering to take them for a short time so that mom and baby are able to rest. Supporting mom during the feeds, and I have especially nighttime feeds. And so if there's, you know, any nursing pillows or supports that mom needs to be able to get comfy for that feed, you know, bringing some water or another beverage for snacks, any supplies that mom might be needing, if she needs, you know, a nipple shield or a breast pump, or, you know, anything that's going to help support her during those feeds. And if it's nighttime and, you know, there's a support person available, maybe, you know, being the one to get up and go get baby from the bassinet or the crib to bring baby to mom, so that mom's not having to get up out of bed each time for each feed, especially if there's still some postpartum healing from birth happening. So that can be a really amazing way to support a breastfeeding mother. Offering to cook a nutritious meal and bring it to the family after a new baby has been born. And one of the most important things that we can do to support breastfeeding women and families is to offer words of encouragement, honoring and respecting and supporting any breastfeeding goals and choices that a mom or a family may be making, you know, regardless of what those may be. And just, you know, really honoring that it's their decision for their family and their baby. And I just wanted to share, in the early days when I was breastfeeding my son, my first baby, and, you know, I was really engorged and my baby wouldn't latch, and, you know, it was a challenging few days and a lot of emotions in those first few days after a baby is born. And just so grateful to have had friends and family members, and we were lucky we had midwives who came to our house and brought meals and really, you know, wrapped around us with supports to make sure that our breastfeeding goals were successful. So I'm a really, you know, strong advocate for surrounding a mom and family during those early days to make sure that that they feel supported in their breastfeeding choices. And so most of the time, breastfeeding kind of naturally works itself out. Babies are born usually like instinctively knowing how to breastfeed, and Marguerite kind of touched on that, you know, they will they'll root towards the breast. They know what they're looking for. They use their smell and all of their senses to really get to that breast early in those early moments after birth. And usually breastfeeding is established in those early days. But sometimes, like I said, it is a learning curve. With each baby, it's a new relationship that you're developing. And so sometimes there's things that come up that it might be really helpful to have some extra supports for. So there's a few things to kind of note when you may want to reach out for those extra supports. And that can come from your doctor, your midwife, maybe a community health nurse. If your family has a doula that's supporting you, your aunties, grandmas, maybe a pregnancy outreach worker from a program in your community or something. But there's so many resources that can help with those breastfeeding challenges, and if not, connect you with somebody who can. So some of the things you may want to watch out for throughout your entire breastfeeding journey is if your nipples or your breasts hurt, if you have a fever or maybe you're feeling unwell, if your baby's having any trouble gaining weight, if your baby is sleepy and needs to be woken up to eat, if you're feeling worried or frustrated about breastfeeding, or maybe you're considering weaning so stopping breastfeeding altogether. Or if for some reason you're worried about yourself or your baby at all, then those are all really good times to either reach out to somebody yourself and share how you're feeling, or ask a support person, somebody that you trust, to reach out to one of your care providers or another support person for that extra care. And so there's a really fantastic resource in BC that's open to all families throughout the province through BC Women's Hospital. And they have a call-in line that you can reach out to speak with a lactation consultant about breastfeeding. And so that's available to any families. But there's also typically at your public health unit or maybe at your community health center, somebody who may be a breastfeeding counselor or a lactation consultant, or has a connection to somebody who has that kind of specialized support that you could connect with, to make sure that you're feeling like you have the resources and the tools to address any of the challenges that might come up throughout your breastfeeding journey. And so sorry, go ahead, Marguerite, were you going to say something?
I wanted to say too that I've noticed in this late stage in life that some fathers are really good. Some fathers will help you, and they will grab your baby, look after your baby, and they do small little things for you. I've noticed that. And also that they do, make you a snack or give you cup of tea, something that a mom needs, because when the stressful moments happen, who is there for you? And, like, I applaud the men that, the fathers, your partners that are there for you, because I see more of that these days, whereas before you were alone and your partner was working and wasn't there for you, and you didn't have access to your aunties, your cousins or mom. But nowadays it's really important to have that connection also with the father of your baby. But it could also be a grandpa, a grandpa could step in and walk your baby and give you a break, and through sometimes some stressful times. And I wanted to put that in there, and I want to encourage the dads, the fathers, the partners, whoever's in your family, to help support you in this beautiful time of that gift that you're giving the family. That's all I want to say.
Thank you, Marguerite. That's such an important reminder. Dads play partners play an enormous role in the breastfeeding journey, and so very grateful for that reminder. And also, maybe if you're a care provider or a support person in another way you can support a mom or just kind of reassure a mom in her breastfeeding journey is, just creating safe space and sharing that, you are there to support them, and that it's, this is a safe space for you to breastfeed your baby. You don't need to, leave the room to go breastfeed, in hiding if they choose to breastfeed there. And just making sure that we're creating safe spaces for families to breastfeed their babies and feel supported in that. So thank you, Marguerite. I wanted to share some really fantastic virtual resources that are available. So there's, I'm sure most of you have Google searched breastfeeding resources, and there's, this vast wealth of knowledge on the internet. But there's some really fabulous resources that are available, and wanted to share a few of those with you. And I'd be happy to share the slide deck too afterwards if it would be helpful, so that you can kind of have a further look at some of these resources. But there's a website, Breastfeeding Information for Indigenous Families, which is a really beautiful site that has all kinds of information about breastfeeding and parenting. The Doulas for Aboriginal Families Grant Program, which is a program that's offered through the BC Association of Aboriginal Friendship Centres. And it's a fantastic program that allows families to access doula services, both prenatal and postpartum. And so if there's a doula that's in your community or elsewhere that's connected with this program, then you are able to access their services with no cost to you or your family. So a really amazing resource for families in BC. There's also the Healthy Families BC website, which is great and has lots of really informative videos and things that show, you know, breastfeeding and, you know, more specifically like latch and things that are really helpful to have good visuals when you're trying to work out some of these challenges at home. There's the Kelly Mom breastfeeding website, which has some parenting, pregnancy, and breastfeeding information. And it's evidence-based and really kind of in-depth look at things like, you know, what medications are safe during pregnancy and breastfeeding, or, you know, how to address milk supply or latch issues. And so it's a really informative website that's can be really helpful if you have a specific challenge that you're hoping to find support for. La Leche League Canada, well, La Leche League is actually an international organization, breastfeeding support organization, and so this link is for the Canadian site. And so La Leche League has support groups that are offered in communities around the world, and so you can go on their website for information, but you can also find out if there's a breastfeeding support group that's either in your community or close to your community. And I know kind of during COVID-19, they may not be happening in person, or maybe they're happening kind of socially distanced or outdoors or whatever, but there are virtual breastfeeding support groups happening. And so it might be really helpful to check in to see if there's something happening near you. And that's usually led by a breastfeeding mentor and just a really awesome community of other breastfeeding families. So some peer-to-peer education, and just nice sometimes to be connected to other families that are experiencing similar, you know, breastfeeding challenges. And then finally, there's Breastfeeding for the Health and Future of Our Nations, which is a really lovely resource it contains some medical kind of focused breastfeeding information, but also a lot of really beautiful breastfeeding information from kind of a traditional lens. So a nice resource that blends the two of those together. And just wanted to say thank you for allowing us to share some of this information with you today, and wanted to kind of put a plug in for next Thursday, October 14th, or sorry, next Wednesday, October 14th. We will be back and chatting a bit about some more specifics around breastfeeding. Today was pretty general information, but next week we're hoping to chat a little bit more about kind of the realities of breastfeeding a newborn baby, some of the technical pieces like you know, milk supply and how to address milk supply issues, latch positioning, and those types of things. So really looking forward to that conversation. And Marguerite, maybe I'll turn it over to you if you had any final words or thoughts that you wanted to share with everybody.
Okay, my last word is, when I was a young mom, I had no access to all of these organizations that you spoke about, Ashley, and I had no idea about postpartum. I had no clue that I was experiencing it, and I didn't know that my behaviors were part of that postpartum. So I encourage the moms to be, you know, that are going to have the baby, to have access to that information, because it's going to help them understand why they're behaving the way they are and why these different feelings are popping up. I didn't have that information when I was a young mom. So I encourage the moms to be well prepared and learn all these things before your baby comes. It's to help you look after yourself and that gift you're having. That's all I have to say. Thank you.
Thank you, Marguerite.
Awesome. Yes, thank you both. I did just want to let participants know that I think what we'll do is we'll stop recording in a minute or so, and then we'll just kind of open it up for anyone to say anything that they'd like, ask any questions. So before that, though, I just wanted to extend my gratitude to you, Marguerite and Ashley, for being here today with us. And, you know, I'm not a mom, but something I've been thinking of during this pandemic is the experiences of new moms to be, or moms have babies. And so I'm really grateful that we're able to kind of gather in this intimate space and share this knowledge, because I think it's really important. And so, you know, you talked about the connection piece and needing a support group. And so you two being here is really, I think, just a really good you know, way to kind of also provide that support for people who may not have it right now. And so quickly, what we'll do